record. Hi, so welcome to our Timmy Global's Health annual Global Health Week, April 6th to April 10th. We're proud to welcome Professor Zaman. Zaman studies systems biology of cancer, cell adhesion and migration in 3D environments, cellular mechanics, and applications of BME in the developing world. One aspect of his lab focuses on access to better health for refugees and marginalized populations, and the role engineers can play in improving the health of the most vulnerable groups. The other focuses on cancer research. Ayomide, if you want to start off the questions.
So the first question we have is, may you please explain your relationship to and projects with refugee communities?
Yes, well, thank you so much for having me, and thank you for organizing the week and this remarkable effort. So over the last 5 years, my lab and my research group has been working on access to health among refugee populations in the Middle East, in Lebanon in particular, with both Palestinian and Syrian refugees, in Uganda with the South Sudanese population, and also we just started a project in Colombia with Venezuelan migrants, and I grew up in Pakistan, where there are over 2 million Afghan refugees. I'm also I started with Professor Kerry Preston in Kalash Honors College, the program, the university-wide initiative on forced displacement. There are a number of classes that we sort of offer in that regard, research activities, as well as our summer and winter programs, which take students to and with so many organizations and others in these places. The goal is for us to create an opportunity for our students to learn, understand, and hopefully contribute towards alleviating some of the challenges faced by people who are forcibly displaced from their communities.
Thank you. The next question we have is, how will COVID-19 impact most vulnerable communities?
I think there are several dimensions to that. The first one is, of course, now we know that all countries are affected, all regions of the world. So that means that people who are in refugee camps are affected just by virtue of the fact that they are a part of our global village. Second, the things that we often tend to suggest and prescribe, social distancing and extensive hand washing may not be possible in these communities. Water is often lacking. Clean water is an issue, and people live in tight spaces where they do not have the luxury of distancing themselves. We also know that many of these communities are very vulnerable to xenophobia and racism and exclusion, and are hence scared and are unlikely to really be proactive and go out because they're certainly concerned. Also, very little testing has been done, and we know that countries that have done well in terms of minimizing the impact of it are countries that have tested extensively. So if you look at all of these things together, this ends up becoming sort of a very toxic cocktail of challenges that the refugee communities are facing, and they are communities that do not have the political agency to really raise their voice and are at the mercy of host communities. So we often don't hear much about them because they don't have the platform to really raise their voices.
Yeah, that's really interesting. I was reading an article today about how they're saying like the slums in India might be getting exposed to COVID too, and how that might really impact India. Do you have any thoughts on that?
I think anywhere you have socioeconomic disadvantage combined with poverty and people sort of living in very tight, confined spaces, you will have that challenge. I think slums in India or in other countries are very, very vulnerable. And there are multiple reports where people are saying that they are worried about basically whether they would die of hunger or they would die of the coronavirus, right? So I think these are very real challenges that they have. So I think these are very difficult times, and people who are socioeconomically disadvantaged, even in this country, are having a sort of a really and facing the brunt of this. For example, in Detroit, nearly 40% of the people who've died are African Americans. That is not the percentage of African Americans in the city. It's, I think, 13 or 16%. So you start to see these challenges manifesting themselves across the country, in this country, and across the world. And people who have nobody to speak for, people who are inherently scared and are stateless and are voiceless, are going to be impacted quite a bit unless very proactive measures are taken.
Yeah. Yeah, that leads into the next question. What preventative measures can be taken?
I think, first of all, I think that it has to be multidimensional. First of all, you have to recognize that many countries, in fact, most countries that host a large number of refugee population are themselves low or middle income countries. So they do not have extensive resources. Their own resources are stretched quite thin. So that means that you need to provide internationally support to these countries as well, whether it's Pakistan, whether it is Lebanon, Jordan, South Sudan, Uganda, Colombia. So that's one dimension of that. Second, I think you have to appreciate that these communities also require care in terms of not a heavy-handed approach, but one that is built on trust, right? So you need to have people who work with them who speak their language, who are trustworthy, organizations that have a long history of working with them with trust, as opposed to really sending disproportionate force and forcing them to do one thing or the other. That is not going to work very well. So I think it's very important to recognize that we are able to do these things in a way that is building trust, as opposed to something that sort of really marginalizes these communities. Many of these communities also have people who are scared, scared of being deported, scared of being incarcerated. So that is important in that regard. I think the final part, which is important, is that you have to have things that are rooted both in empathy and in good science. So you have to make sure that the messages that are given to these communities, whether it is hand washing or whether it is exclusion, are based on solid science, and also empathy that has to recognize the unique context of these places.
Okay. Considering that these health infrastructures are already very limited in their resources, would it be more important for them to continue focusing on providing critical care, or should these communities be shifting to a more emergency response to COVID?
I think that's a great question, Emma, and I think one that one has to think about in terms of health systems. The fact that you have a COVID challenge doesn't mean that some of the other challenges have already disappeared. So that's one. The second part I think you have to understand is that we often don't associate non-communicable diseases with some of the refugee communities. But in our experience, and also in other experiences, you'd find plenty of people who suffer from, for example, respiratory ailments, which make you a vulnerable group in this regard, right? So this means that you have to be careful. I think, like everywhere else, you have to prioritize, and it has to be done in a way that is rooted in good data and good science. So even in this country, for example, people have decided that elective surgeries that can wait a little bit will be deprioritized over things that are immediate. And I don't want to be prescriptive here, because I don't think that's the right approach, but places have to make that decision on what needs immediate support, but also not sort of giving up on people who may need immediate emergency care, which is non-COVID related, right? So if somebody has a cardiac arrest, or somebody needs, for example, cesarean section during childbirth, that doesn't mean that should just be completely deprioritized and you sort of completely abandon that. The goal here is to save as many lives as possible. And that should be inclusive of COVID, but not sort of really take away from what already exists. So I think we have to be careful there.
Okay. I believe that access to education in these communities is already very variable. What do you expect will happen to students, young students, in the coming year or so, coming months, as COVID impacts them?
I think that's a great question, and I think all of us, unfortunately, are trying to handle things in ways that are, I would say, really sort of trying to do it in a very ad hoc way, whether it is institutions in high income countries or in low income countries, which means that you have to have contextual plans. Um, in certain communities, even in this country, online learning is not possible if people don't have access. Now, just multiply that challenge many fold in places where learning is already challenged. But I think one has to, again, uh, plan and think of ways that are contextually appropriate and are rigorous. I don't think there's any reason to abandon education. One shouldn't, I think, but people should be given an incentive, the people as in you, me, and others, to come up with ways that work in these scenarios. I think we are not thinking about that hard enough, and I think there's an opportunity to really create things. It's a terrible, very difficult time, but there is a small silver lining, and a small silver lining there is, here's an opportunity to fix many things that have not worked well for a lot of people, in ways that when we come in a post-COVID world, those things work for those people who have been left behind for a very long period of time. And this may be one opportunity to really think about improving access to care. I think things have now been laid bare that a lot of people have been struggling for a very long time. And here's an opportunity to sort of strengthen it just a little bit. There's an opportunity to sort of improve it for just a little bit, and in ways that can become hopefully permanent. And I think education is one such area where if we think hard enough, we might be able to do things that may work for a lot of people in for a long period of time. Um, I think many of us are now in a situation where our lives have been uprooted in very important and very strong ways. But there are people whose lives have been uprooted well before COVID came. And I think this may give us an opportunity to be more reflective, more humane, more cognizant, more humble, and do things for other people as well.
Thank you. With that in mind, while we hope that students are being creative and individuals are supporting their global community, what is one organization you support and why?
I think it's an answer you have to. I mean, it's a question you have to understand in the context. You should do your work in terms of looking at what organization best represents the values that you care about. For some people, it's women and child health. For others, it's water and sanitation. For another person, it might be nutrition. And I think those are all absolutely important things. But if you sort of provide for the organization that best aligns with your values, I think you are much more likely to be engaged with them, and sort of have a long-term partnership. I think we know now, unfortunately, that domestic violence or gender-based violence is increasing because people are reporting it all across the world, and this has been an issue in refugee environments for a very long period of time. I think there are huge systematic issues of discrimination. I think nutrition is a huge issue. I think trauma and mental health is an issue. There's a very long list of things that you can do. All of us have our own limitations. So my suggestion to you and to all people listening to this would be to find something that you're most passionate about, that you're most that you feel strongly about, and be a part of this for the long haul. Not to ignore other things, but you're much more likely to contribute, engage, learn, and be a part of that community. And if we all are able to do that for the long haul, I think it will help everybody.
Yeah, thank you. And another question is, so we already see like how in New York City that the healthcare system is getting really overwhelmed. If these same situations occur in underdeveloped countries, how do you think it'll affect their health infrastructure?
It's a great question, and we don't know. I think it has been stressed in every place. Um, the reality is it's not going to be good. But I think it may also give them an opportunity to fix things that they may have ignored for a long period of time. And that's the optimist in me sort of thinking that some good might come out of this. But I think in terms of the stress on the system, it is going to be very challenging. I'm also worried that because we are increasingly looking at a recession that is going to be there for some time. In times of recession, international aid tends to decrease, not increase, which means that we have to worry about the impact of that as well. So I think the stress on communities, the stress on health systems is very real, and yeah, and I'm fairly concerned that it might sort of hurt it, and more people become dependent on it, while the system at the same time will not be able to take care of all those who need the help.
Yeah, that's really interesting. And then also, like, do you have any, or I guess, any ideas of how we can ensure that these basic healthcare services will continue to be provided even after COVID passes away?
I think one of the things we have to argue uh, is that we have to use this opportunity to argue for long term public health strengthening. Um, Worry is, and I hope I'm wrong, that this won't be the only pandemic in the future. I think there will be others coming. I hope it doesn't happen, but I think we have to recognize that these things can happen. And a strengthening basic public health system that works for everyone across the socioeconomic divide is absolutely needed. So I think in some ways we have to pay attention to the immediate, to the here and now kind of a situation, but also plan on how do you sort of protect those who are vulnerable for the long term. It's not, I mean, people tend to focus on new and exotic and fancy and sort of innovative things, but I think this has demonstrated that we need to have strong fundamentals on which we want to stand, and need to be prepared for that. And for a very long time, we have been sort of ignorant of the gaps that exist in our system, and that is just not okay.
For those of us who do want to go into public health in our future careers, especially with everything going on now, do you have any advice for us as students?
I think
Or
my
like,
advice is to find passion for things that you care about, and do so with a sense of humility, but also focus uh, on these things with rigor. I think we need scholars and doctors and public health professionals and intellectuals who really bring expertise, but do so with a sense of empathy and collective social good that helps everybody, not just a few. And I think if we all are able to operate that, and we care about not just those patients who are coming to the hospital, but also the doctors and nurses who are at the front lines, the emergency responders and the janitors, and people in New York City and also in the Shatila camp. I think all of that would be phenomenal. But I think it's an opportunity to learn and think and reflect and recognize that there's a lot good that we can do if we are able to sort of use our passion and with both scholarship and a deep sense of collective human dignity.
thank you.
Oh, sorry. So you mentioned that xenophobia is oftentimes a problem in many refugee countries. So how does the outbreak affect sentiments towards refugees in these countries?
I think you have to understand that xenophobia works in several different ways. So one of them is that governments that are not particularly keen on hosting refugees might use that opportunity to shut down their borders even more, right? So at this time, the nationalist agenda might really supersede a more humanitarian focused approach. So that's one. Two, think about it this way, that if you are already a marginalized community living in a small, tight space, and it turns out that you're positive for COVID, what do you think is going to happen to you? You're not going to be sort of treated very well, and there's a risk that you may sort of be considered an outcast, right? So that's number two. Number three is that if xenophobia is pervasive, and there is a risk to your physical, mental, emotional health as you go from your home or your camp to the hospital, well, you probably won't go because you don't want to risk that chance. That means that the likelihood of getting tested decreases further. And then finally, because you are worried, because you are concerned and anxious, any effort by the government, you will have a good reason to be suspicious, whether it is really meant for your benefit or there is some kind of an underlying agenda there. So it really affects on multiple dimensions, and that's why it is very important to have community members engaged, people in groups that enjoy the trust of refugee communities engaged in this. Otherwise, it is not going to be effective and is only going to increase sort of marginalization and a sense of anxiety among refugee communities.
My other question is that oftentimes refugees lack a lot of access to a lot of resources. So what effects do panic buying and gouging have on these refugees and their communities?
They often don't have any capacity to do that because most of the cases, they don't have any sort of disposable income to really do any panic buying or have that. So, I mean, they're barely making do. This is something that I mentioned earlier, that people are worried that they might die of hunger before they die of coronavirus, right? So that's not something that I think would apply. What might apply, however, is the fact that they may not be able to go to the places where things are being sold because of complete lockdown. They may not have any mechanism to be able to get to the places where things are sold. That's one. The second thing is many refugees work as sort of daily wage earners and are going to be hit very hard. So I think those are many dimensions there that you have to think about. One thing which does happen, not always, but happens, is that they sometimes get direct food rations from UN organizations or other NGOs. In that case, they would not be in the same boat as others in panic buying. But I think refugee communities are not uniform. There are many who live in urban areas. There are many who live in camps. There are many who live within dense urban metropolises, and others who do not. Many are dependent on food aid while others may work. So I think it's a multi-dimensional, multi-layered population, and that's why the response and the approach has to be nuanced, and not a single approach is going to work with them automatically.
Returning to the more creative solutions, how could you budget and potentially produce something like a respirator at a scale necessary for refugee communities? I mean,
so there are two components of your question, Emma, and I think both are important. One is how can you produce, and how can you produce at scale? The answer to scale is that you cannot. You will have to work with an organization that has the manufacturing capacity to produce things at scale, right? So you cannot produce hundreds or thousands of them by 3D printing it. That is just not going to happen. So you'll have to work with companies that are able to do that. Second thing is respirators or ventilators require an infrastructure. They cannot be just sort of put into a tent, which means that what you need to do is need to improve both the capacity of the hospitals where these people would go should there be a need, and also facilitate the access to that, right? What can happen, so then the problem becomes twofold. One is, how do you make sure the hospital is ready for them through ventilators and respirators, and there you can come up with some designs and maybe some 3D printing, but it can't be done at scale. But perhaps a better opportunity might be, how do you make sure that people who do feel sick are able to get to the hospital in time, ideally early enough, or there's testing in a way that is not going to stigmatize anyone. I think that might be a better approach than bringing a ventilator to the camps, because you don't have the clinical infrastructure that is needed.
Okay, another question I had is, how expensive is the cheapest available test for even just a general virus? How cheaply could one be produced?
So I think that's a great question, and I don't know the answer to that. I think a lot of the tests are now fairly subsidized, and I think the ones that are available near these refugee camps, as long as they are coming from UN agencies, are actually going to be free for them. So but those are probably in small numbers. If they go to the private sector, the numbers can be very, very high, completely unaffordable, right? So they may be in tens of dollars or $100. So that, I think, is going to be they're going to be inaccessible. So I think one has to increase the public sector capacity for testing, because the private sector testing is going to be too expensive for them to really do anything, and is going to be a disincentive, right? I mean, nobody wants to spend $100 in this country if you are socioeconomically disadvantaged, let alone a place where that number, that amount of money is just completely way beyond their accessibility.
Thank you. Thank you for joining us today. Do you guys have any last questions?
No, I don't. Thank you so much, Dr. Zaman.
My pleasure. My pleasure. I'm happy to talk anytime, and good luck with the rest of your efforts, and keep me posted if there's anything I can do. All right?
We really appreciate your approach, even with our engineering design course, to try to find creative solutions to these problems.
Good. I'm glad you like it, and keep up the good work, Emma. You guys are doing very well, and I'm very proud of that.
Thank you.
All right. Take care.